Good day, everyone. My name is Raven Room. I live in Lapalapa, Proclongoy, Digo City, Davao del Sur. 22 years old from BPA 4A. So here's my policy. All hazard preparedness a policy which strengthens national preparedness and response to public health emergency. Information. To address public health emergency, the Secretary of Health will lead the development of national health policy with regard to all issues pertaining to national public health and medical readiness, as well as the execution and deployment of national response before, during, and after public health emergency. These plans shall provide for integrated policy coordination and strategic direction. Provisions to improve ambulatory care facilities, dental health facilities, and critical care service systems, readiness, response capability, and surge capacity, plans for maximizing a coordinated and adaptable, approachable to the critical care, trauma care, and emergency medical system, capacity to provide medical care in times of medical emergency, provisions in a public health emergency that take into account the particular requirements of people with disabilities, developing strategic countermeasures against any biological agent or toxin, as well as any chemical, radiological, or nuclear agent or agents, whether naturally occurring, unintentional or intentional harmful, conducting regular system of local and national preparedness and response capabilities, including drills and exercises to ensure medical surge capacity for events without notice and stand for financial costs. Issue: numerous floods, disasters, and epidemics that have killed large portion of population have occurred throughout history. For instance, the Black Death, also known as the Black Plague or bubonic plague, was one of the deadliest pandemics in human history and was commonly believed that the bacteria Rehishnia pestis was to blame, but some people now believe that other illnesses were also to be blamed. 75 million people were estimated to have died, according to Worldwide Organization or World Health Organization, with 25 to 50 million of those deaths taking place in Europe. Health professionals convened emergency international meetings in June 2013 to come up the solution for a known virus that has been dubbed the worst global public health hazard. To discuss how to address the Middle East officials and medical professionals gathered in Cairo. AIDS respiratory syndrome, or MERS, is a new pandemic that experts believe will deadlier than SARS. The term SARS stands for Severe Acute Respiratory Syndrome, or SARS-CoV, a viral respiratory disease of zoonotic origin, and SARS outbreak in southern China between November 2002 and July 2003 resulted in a total of 8,273 cases and 775 deaths that were recorded in numerous nations. Impacts analysis required to develop the strategic will be carried out by the task force that reports to the Secretary of Health. Representatives from the following entities will make up the task force: the NDRRMC or CDRMC, the National Disaster Risk Reduction and Management Council, to the Interior and Local Government Department, DILG, the National Security Advisor, as well as the PNRC, Philippine National Red Cross, and also the DOH, Department of Health. Preparedness refers to activities and measures taken in advance to ensure effective response to the impact of hazards, including the issuance and timely and effective early warnings and the temporary evacuation of people and property from threatened locations, and also refers to the pre-disaster efforts such as intentional and management structures, general policy, and strategic that are aimed at assisting at-risk reduction communities and protecting their people and property. Continue for impact. Being aware of dangers and acting appropriately in the event of an immediate threat or the disaster's actual commencement. Implications. A task force that reports of the Secretary of Health representatives from the following entities will make up the task force: the NDRMC, the National Disaster Risk Reduction Management Council, Interior and Local Government Department, the National Security Advisor, as well as the PNRC or Philippine National Red Cross, and also the Department of Health. In the event of public health emergency, keep track of new issues and worries as the effect on medical and public health readiness and response for those who are at risk. Steps required to overcome these challenges, as well as the gaps, redundancy, and other inefficiency in medical and public health readiness and response activities as soon as it is practical, including from moment a public health threat, and identify, disseminate new and updated best practice of outreach to and care of at-risk individuals before, during, and after public health emergency, and ensure that public health and medical information distributed by the government is accurate and presented in a way that considers the variety of communication requirements of intended recipients, including at-risk people during a public health emergency. Imperatives. This policy aims to improve national preparedness and response and is based on such wisdom. There is an old adage that states that an ounce of prevention is worth a pound of cure. For a situation involving a threat to the public health, such as those brought on by current pandemics, natural disasters, and extreme weather, bioterrorism, or chemical emergency related to radiation, activities and precautions made ahead of time to ensure that successful response to the effects of dangers, such as the dissemination of prompt and reliable early warnings and short-term removal of persons and positions from dangerous areas. With this approach, it is crucial that everyone is able to recover from the sickness and prevent future outbreak. Such as the example for this is the pandemic from the China or called COVID-19. If nothing is done, I believe that people could easily pass away without the assistance of medical personnel. Thanks to this policy on the readiness of public health emergency, we are incredibly grateful for the past events that helped us to all survive the quarantines, crisis, and lockdowns caused by COVID-19 epidemic or pandemic. I appreciate every frontliner. And that's all. Thank you very much.